Hello, my name is Jordan Hermiller. I'm a senior application expert with Agfa, and in this short presentation, I'm going to discuss how your X-ray system can help patients avoid fragility fractures. So population health and preventive medicine are common buzzwords in healthcare today, but for good reason. Mission-driven hospital systems who are focused on patient outcomes are also focused in these areas and on chronic conditions. And in America, 10 million people have osteoporosis and 54 million have low bone density, placing them at an increased risk for these fragility fractures. And so it's no surprise that 1 in 4 people will break a bone due to this disease. And the hospitalization burden of osteoporotic fractures is actually greater than that of heart attacks, stroke, and breast cancer. Osteoporosis is often referred to as the silent disease, as patients often will not experience any symptoms until after they've experienced their first fracture. And while effective treatments exist, osteoporosis remains undiagnosed in 80% of cases due to a lack of screenings, which is largely why Healthy People 2030 has identified it as a public health priority. But what if your X-ray system could not only detect fractures, but help prevent them as well? Agfa plans to join the fight against this silent disease, and we're excited to introduce density scan. So using just a standard radiograph, density scan will identify patients at an increased risk of fracture by returning the same outputs as a DEXA scanner. So this can be used to opportunistically screen patients and enables earlier and more widespread diagnosis of osteoporosis. Density scan runs in the background. It's fully automated and requires no change to the technologist's workflow. Density scan uses several inputs, including the ratio of the direct to scatter radiation, to deliver a full bone health report to the radiologist and the referring provider. And as you can see, I've provided an example on the slide of the bone health report. The results section includes the bone mineral density, the T-score, and the probability of osteoporosis at the femoral neck. And then the hospital or the clinic can also customize the guidance section on the bottom based on their care pathway and processes for osteoporosis. So, then a common question is related to the accuracy of density scan, which is more technically referred to as quantitative X-ray. But, maybe more specifically, the questions are related to the correlation of density scan to DEXA outputs. And there's been a number of studies performed to demonstrate this correlation. So one such study, published in the British Medical Journal, as you can see on this slide, found density scan technology to have a highly reliable rate of true positives and low false negatives compared to DEXA. And the ultimate takeaway of the study was that density scan provides an accurate prediction of the likely outcome of a DEXA scan, which provides enormous potential for pre-screening and early intervention. And in fact, of the imaging modalities, general X-ray is the ideal vehicle for screenings. It's the most accessible, it has the most volume, it's low dose, it's fast, and it's easily the most cost-effective. So I already briefly touched on the benefits to population health, but I also wanted to add that osteoporosis contributes to almost 3 million broken bones per year, and 300,000 of those are hip fractures. And we know that 1/4, so 1 in 4 of these individuals with a hip fracture will actually die within 1 year. So with density scan, it's estimated that 1 fracture will be prevented for every 70 assessments, bringing clinical interventions forward by up to 15 years and giving the aging population many more decades of happy, healthy, and active life. Density scan also has the potential for significant cost savings to our healthcare system. So these osteoporotic fractures are estimated to cost our healthcare system $25 billion per year. And for those hospitals that adopt this technology, not only will they be positively impacting the lives of their patients, but there's also opportunity for downstream revenue to manage and treat this patient population with osteoporosis. Okay, so where are we now? It's planned to be released in 2024. So initially, density scan will use a wrist radiograph to provide a full bone health report. That said, work is underway to extend density scan to more and more body parts, starting with the knee and foot, and then the pelvis and others. And as I mentioned, again, the initial plan is to provide these opportunistic screenings that may lead to a DEXA referral for diagnosis. But the ultimate goal is to offer it density scan as an alternative to DEXA scanners, which would also allow radiology departments to cut out these capital expenditures for these DEXA scanners and also open up space previously occupied by these single-use scanners. And so, the accuracy and the technical maturity of this quantitative X-ray and density scan technology has been proven. But to understand its full potential for diagnostic impact, we need to continue working with the right interdisciplinary care teams to determine where this technology can best improve the care pathway for osteoporosis, and also identify any hurdles to its adoption. So again, this conversation extends beyond our normal conversations with radiology departments and radiologists, and it includes rheumatologists, orthopedists, PCPs, and so on. These are conversations we continue to have with hospitals, and we certainly welcome any interested parties who wish to collaborate in moving this life-changing technology forward. Thank you.